Hello. Just fix this lighting real quick. Hello, everybody. Dr. Sarah Lutz here of Pure Light Family Chiropractic. Screen looks a little blurry. There we go. All right, I think we are good. We're live. I will be waiting for a thumbs up from Dr. David in the chat box that all the sound and everything is working. But thanks so much for joining me tonight for this incredibly important topic on tongue ties and lip ties and what we can do to help them. So this is a large percentage of our practice. We see these babies with these tethered oral tissues, or you might hear the word TOTS, T-O-T-S, or tongue tie, lip ties on a daily basis. It's very prevalent. And we find in our practice through the body work that we offer, as well as collaboration in our community, we see babies and families overcome these challenges all the time. And it's a topic that as a new parent can feel overwhelming. So our biggest goal with sharing any of these webinars and information is to empower you and to inform you and to make sure that you, when you are having these meetings with lactation consultants or your pediatrician or revision expert dentist, that you feel confident and empowered and not overwhelmed. Because let's be real, being a new mom or dad is very overwhelming anyway. And then all of a sudden you have a newborn or an infant with these challenges that need to be overcome. So this is to inform you and to empower you, help you feel confident and not overwhelmed. And again, this is for you who's watching. So if you have any questions or specific situations with your baby, feel free to type them in the chat. It'll pop up on my screen here and I'll be able to address that right away. And again, with this information, speaking of being overwhelmed, so this is to be a resource for you. So if you feel overwhelmed at any point watching this, know that you can go back and watch it again. It's going to be recorded. It'll be always on our Facebook and YouTube for Pure Light. And it will be up on our website, purelightfamily.com, very soon. And you can go back and watch it anytime. Again, ask questions. And this is a topic that I'm very passionate about, and I've been researching for a long time, and I've learned a lot clinically. And so I have a ton of notes. I don't know how long I'm going to speak. I might speak for 30 minutes. I might speak for an hour. It really partly depends on the chat and if you guys have specific questions or needs. And I'm just going to talk for as long as I need to. And again, this information is for you. So you can always go back and listen, share with, thumbs up. It's all working. Great. Thanks, Dr. David. So you can always go back and share this with your partner or with any friends or family you know who are struggling with the ties, and know that this information is evidence-based, well-researched, and it's here for you. So one disclaimer. So I am about 25 weeks pregnant, so excited, but I have to say this because I've been getting out of breath more when I talk. So if you're like, why is she so out of breath? I am talking a lot, but I'm also pregnant, so it's part of that. So please excuse my breathing, heavy breathing over here, but it's all good. We're very excited and very thrilled to have another baby in the fall. Okay, so I'm going to jump right in. We're going to first talk about what is a tie. Then we're going to talk about causes of ties. Why are they so prevalent? We're going to talk about symptoms of ties that you'll see in babies as well as nursing mothers, and management of ties and recommendations moving forward. So let's jump right in. I don't see any questions so far, so we're doing good. So what is a tie? So until you're a parent, you may not have even heard of a tongue or a lip tie, or also known as tethered oral tissue. And that is exactly what it is. So it's oral tissue, so tissue in the mouth that is tethered down. So it's not supposed to be there. It's anchoring down the tongue or the lips. And there's different variations of these ties, and they're unique to each baby. But when you hear a lip tie, it's going to be a piece of tissue that's anchoring down the lip. So that usually the top lip, so underneath the top lip, right where it meets the top of the teeth on the gum line, there'll be an extra piece of tissue there. And it doesn't allow the lip to flare out as much. And this can lead to issues with nursing and beyond. And we're going to talk about it's beyond breastfeeding issues with these ties, but that's usually the first most important thing that's addressed in these babies. You have tongue ties are typically going to be underneath the tongue. So literally underneath the tongue, there'll be extra tissue there anchoring the tongue down. And this has different levels of severity. There's anterior lip ties where it's literally just the front, or anterior means front of the tongue is anchored down, or it could be further back, deeper under the tongue, called a posterior tie, towards the back of the tongue. And these have different levels of symptoms and, severities in terms of their needs for management. But that's basically what tongue and lip ties are. It's extra tissue anchoring down the lip or the tongues. A less common talked about form of a tongue tie is called a buccal tie. A buccal tie is going to be anchoring the tongue down on the side. So under the tongue on either side, usually it's one side more than the other. And this can create asymmetry. So if you see a baby, their eyes might be unlevel, their facial structures are unlevel, and they might have a torticollis, which is a tilt and turn of the head that isn't easily corrected with balancing and aligning the structures of the head and neck. So it's typically this underlying deeper cause, and buccal ties and posterior ties are often the most commonly misdiagnosed or not seen because they're harder to see. I mean, if you've ever looked inside of a newborn or infant baby's mouth, it's really hard to get a good look at what you're looking at, especially if you're a new parent. And that's why it's really important to have professionals in your life to help you. And so we're going to go into all that as well. So that is basically what a tie is. And I'm going to go deeper into how it affects the body. Are there any questions so far on what is a tie? We're good? Okay, cool. So one more side note, so just looking at my notes. If a baby has a lip tie, they most likely also have a tongue tie. Experts will often agree that they go hand in hand, and clinically I've seen that as well. So sometimes a lip tie is really obvious, a tongue tie is not as obvious, but if they have one, they usually have the other. Just typically that's how it works. Okay, so how do these tongue ties affect the rest of the body? So it's not just a breastfeeding issue. Symptoms of tongue ties can be reflux, colic, airway growth and development issues. So mouth breathing. We could literally do a whole webinar just on mouth breathing and the rabbit hole of negative effects it can have on one's health. Facial growth and development. So abnormal facial features and development, sensory processing issues in older kids, breathing challenges, again, with that airway development, sleeping issues, spinal development, which as a pediatric chiropractor, I'm going to go really into that a lot and explain how that works. And then further along down the line, the tension and stress in their system can lead to ADHD and all sorts of other challenges. And another symptom will be basically just that development from once they start to hold up their head. Babies with tongue and lip ties don't typically like to be on tummy time because they're anchored down in the front. So lifting up their head creates all the stress and tension in their body. So if your infant doesn't like tummy time, it's often because of the ties, and that can be a big issue. We have a lot of information shared on our social media and our website about tummy time and the importance of it for development, for motor development, for cognitive development. So you can see how a simple tethered oral tissue in the mouth can lead to a whole host of other effects. And I'm going to go into really how it's all connected. So the first thing to think about is your nervous system. So your nervous system this is going to kind of go into causes of ties now. I'm going to mix causes of ties and what is a tie a little bit together. So when you're looking at your nervous system, think about your brain sits in your head. You have your spinal cord comes down the midline, and your spinal cord is basically a highway of nerves that come out of the different segments of the spinal system. And it's enveloped in a tube called the dural tube. So if you think of, like, most people have heard of an epidural. So when you get an epidural, they're going into the dural area. So the dura is like this thick Under Armour like coating around the nervous system that protects it. And it also allows for the flow of what's called cerebral spinal fluid. I know this is a lot of information through the brain, removes toxins, brings nutrients to the brain. It's very, very important system covering the CSF. It's a protective cushion, and they have these little ligaments, which we work with. And basically what you need to know is this dural system connects to the rest of the fascial system in the body. So the fascial system is like this beautiful coating over all of our muscles and soft tissue throughout the whole entire body. So when you have tension in the dural system in the midline, it's going to create tension throughout the rest of the body. But it's specifically the midline that's the biggest issue. And when you go up midline, up through the front of the neck here, what's called the hyoid bone, you have the tongue attachments back here. So the tongue is like a rudder of this whole system. And so when the tongue is anchored down, it's anchoring down so much else because it literally connects right to this dural fascial system in the midline of the body. And we're going to go into how that relates to the body work that we do and all of that and craniosacral work, but really want you to kind of understand that anatomy. I know that's a lot of information. You don't need to know all of it. If there's, again, any questions, please go ahead and jump on there. There's some people who really want to know the ins and outs, and that's what this is for you. Okay, so when you have this tension in the dural tube from the tie, it's basically affecting the whole entire nervous system, tension through this whole system. It's like a tug of war in this little baby system. So they're already, healing from the intensity of birth and adapting to this new environment, learning how to breastfeed. And then they have this tug of war of tension in their whole system. And it can wreak havoc on spinal and cranial structures. And this neurological stress is literally going to affect everything because the nervous system controls everything. And that's really the link to the digestive stress, the reflux, the colic, and all the other symptoms that can show up. So I know it's a lot of information. I could go deeper, but I think I'm going to hold off there in terms of explaining anatomically what's going on. If you have any more questions, please let me know. And now I'm going to jump into what are the causes. So it's really the research that's out there really points to it being a neuroepigenetic issue. So basically, it's a complex interaction of genetics, epigenetics, which are lifestyle and how it affects the expression of our genes, as well as environmental factors and how these all play together. So when I say epigenetics and genetic, this means that the cause of your baby's tongue or lip tie might have nothing to do with you. It may have something to do with something genetically in your mom or your dad or future generations before you that have been passed down, especially over the last couple generations when it comes to toxicity and mutations and detox methylation pathways in our body, which I'm going to go into. That's really what they're thinking the causes of these things are. So I talked about midline development, brain and spinal cord, nervous system. So when you're talking about development in an embryo, so the very first thing when an embryo is starting to grow, the very first thing that develops is the brain and then the spinal cord. So that middle of the body, which is so fascinating. And then every other structure in that embryo turning into a fetus, into a baby, comes from that midline. So most of this midline development, the original midline development, is happening a lot of times before women even know that they're pregnant. And this is why when, even before you get pregnant and you hear throughout womanhood that it's really important to take a high quality prenatal vitamin and have a high quality nutritional healthy lifestyle before conceiving, because this midline development is often based off of your overall health before you even know you're pregnant. And so the tongue is midline, and these lip and tongue ties are all developed typically before you even know you're pregnant. And so when you hear about a high quality multivitamin, you're hearing about folate. Sometimes you'll hear the word folic acid. Folic acid is no bueno. You do not want anything that says folic acid on it. Folic acid is typically a synthetic form of folate. Folate is what is important for this midline development. And that's why preconceptively, it's really important to be taking a good folate supplement, as well as eating foods that are high in folate. So food sources that are high in folate are green foods usually, so zucchini, romaine lettuce, spinach, asparagus, turnip greens, mustard greens, parsley, collard greens, broccoli, cauliflower, beets, lentils. Those are just a place to start. And you want to make sure that, as much as possible, they're organic, non-GMO. And eating these foods preconceptively, and especially in that first trimester, are going to help with this midline development. But again, it's neuroepigenetic, which means it could be if your mother didn't have proper folate or methylation pathways, I'll explain more what that is, then your baby may have the effects of it. So it could be completely out of your control. But by making healthy lifestyle choices and getting that proper folate into your body, then that can really help. But if you're watching this, you likely already have a baby that has a tongue or lip tie, and that's perfectly okay. We're going to talk about how to help manage and overcome any challenges. So when we talk about that folate supplement and the proper nutrients, it's important for the ability to methylate. And when you hear methylate, just for simplicity terms, think about detoxing in your body. And so there's a specific gene called the MTHFR. It's becoming more mainstream, so more people know about it. And up to 60% of people are thought to have an MTHFR gene mutation, which doesn't allow them to properly methylate. And if you are taking folic acid, not folate, or not eating enough high folate foods, then this whole pathway can get really messed up and cause issues such as midline development. And you may say, oh, well, I eat high folate foods. My prenatal vitamin had folate in it. My generations before me ate lots of great stuff, never had folic acid. The problem is in the 80s and 90s, a lot of foods out there started to be fortified with folic acid. So you may not even realize that you were eating folic acid through certain processed foods that you didn't even realize to look for. So if you ever see something that says fortified with folic acid, don't take it, because unless you 100% know that you don't have the gene mutation, and you can get tested for it. It's really good information to have on your body. If you have it, likely your baby has it. It's passed down. It's an epigenetic change that has just become really predominant. Again, 60% of people are thought to have it. And so if you have this gene mutation, you're not taking the right folate or enough folate, or you're exposed to folic acid, then that's an issue. To bombard on top of that, we live in a pretty toxic world. So we're exposed to toxics all over the place, environmentally, whatever's sprayed at the park or on the streets, the glyphosate, we're exposed to chemicals in the food supply, the water supply, the air around us, and then the plastics that are everywhere, as well as a lot of cosmetics, shampoos, soaps, cleaning supplies. So many things are exposing us to toxins. And when our methylation detox pathways aren't working properly, then you have these environmental triggers for midline development issues. And again, I know I'm going super sciencey into this, and I could go even deeper. There's a couple other genes that neuroepigenetically relate to what they think the causes of these tongue ties are, but just really go back to folate, methylation, MTHFR gene mutation to really get kind of a basic. Another toxin, I'll call it a toxin because it is, that's really, really common is Tylenol. So Tylenol, if you have the MTHFR gene mutation and you take Tylenol, it completely depletes what's called glutathione, which is a very important antioxidant in your body that allows you to detox. One dose of Tylenol can completely wipe out your glutathione and affect these methylation pathways even more. And it's not uncommon for pregnant women to take Tylenol, or preconceptively for you to take Tylenol. It's not uncommon for babies to be given Tylenol after vaccinations, or for teething, or post revision after a tongue tie. And then that's just depleting them even further and causing more issues. So, and circumcision is another one. Babies who have circumcisions are given Tylenol. And if you have a tie, it's causing more issues. So avoid Tylenol. There are homeopathics and other even more pharmaceutical based pain relievers that you can do, but please just avoid Tylenol. The side effects are not worth it. So that was a ton of information on what the potential epigenetic causes of ties are. I'm not seeing any chat comments, so I'm just going to keep going. You guys seem to be following along really well. I hope it's all coming together and making sense for you. I'm going to go into what are the symptoms of ties. So first, we're going to talk about baby symptoms. So typically, you're first going to see issues with the latch and nursing. Oh, yes, you're welcome. Thank you so much for logging in. So with latching, you're going to see the baby might be popping on and off the breast. They might be chomping down instead of getting a nice suckle. They might be chompy with their suck. Clicking while nursing, so it's not a really solid latch, and there might be some clicking happening. Babies with lip ties will have a little bit of a blister on the front of their lip, top lip. They will have poor weight gain. So this is often one of the biggest issues. Thank you, Madison. I'm so glad you're on here too. So glad you guys are logged in. Thank you for the comments. And so poor weight gain is typically one of the biggest issues we'll see. Like that is the red flag that a parent, that's the last thing a parent wants to hear. A nursing mom wants to know that her baby is getting what they need from their breast milk. And when they're not gaining weight, it means they're not transferring the milk properly because their suck and their latch isn't proper because of the tie. So if it's a weight gain issue, typically a revision is definitely going to be necessary, but we'll talk about that later. But poor weight gain in baby is a big symptom. Noisy breathing. So if your baby's like sleeping or just in general, they just make a wheezy, loud breathing sound. That's another sign. Snoring when they're sleeping. If another latching one is if when they're latched, if the milk is leaking when they're feeding, that means the latch isn't suctioned secure enough. They may gag a lot. If you were to just put your finger lightly into their mouth, they gag really quickly. That's something we see a lot. They want to feed constantly, sometimes because they're not getting enough, transferring enough during the feed, so they're never really fully satisfied. They could be gassy because they're swallowing air, and they're stressed. They're not sleeping long stretches because they're not getting satiated and they're stressed. They may fall asleep at the breast because they get exhausted from not being able to really get into an efficient latch system. It may be shallow where you feel like you can't get the nipple deep enough into their mouth. And if you feel their palate, so when I say palate, I'm talking about the roof of the mouth, it may feel really shallow. It should be like a nice curve shaped palate, and it might be really flat or shallow or high or low on one side. So those are baby symptoms. There's more, of course, but those are the main ones. Symptoms for mom are going to be cracked and bleeding nipples, which are the worst, so painful. And there's an element when you first start nursing that things might be a little uncomfortable just as you're getting the hang of it, trying different positions and learning how. But if your nipples are cracked and bleeding and potentially you're developing clogged ducts, mastitis, those are all big red flags that your baby has a tie. Decreased milk supply, partly because of the stress of it all, and also the baby's not transferring properly. Your nipples may have a misshapenness to them from the improper latch. You may be doing prolonged feedings, again, because the baby just wants to keep going and going, or they might fall asleep and you have to wake them up. You might have vasospasms, which is basically like your nipple area will just spasm and be painful. And then for you, mom, too, it can lead to fatigue, anxiety, and depression. So no bueno. Again, we don't want any of these things, but sometimes they're normalized, and it's thought for some moms like, oh, well, breastfeeding is just hard. You just have to push through. You just have to get through it. But if any of these things are happening to you, there's definitely something else going on. You definitely want to get a professional opinion. And, it's really worth it if you can overcome it with professional help, because the benefits of nursing your baby are so big. And if you have to supplement with formula, don't feel guilty. It's totally okay. This is a really challenging thing to overcome, especially with severe ties. It is extremely challenging. And so just know you have our support and that there's other people in the community to support you. Okay, so we talked about the tummy time too. So babies with ties don't typically like tummy time, again, because they're anchored down, and that's going to therefore affect their motor development. And then another symptom is that tilt and turn of the head. If it's a side buccal tie, then it's going to affect the fascial system and create asymmetry in this whole one side of their body. Okay, and I think I covered all of the symptoms. It's a lot. Again, there's probably other things that can show up, but if there's any symptoms of any of that stuff, that is a good sign that you need to get it looked at deeper. So we're going to go into that now with the management of ties. So you think your baby might have a tie. Who do you see? Who do you talk to? So we get referrals from other providers and experts in the field every day. And thankfully, we do have some great resources in this community for you. It really is like a triangle of co-management, we call it. So it really does take a village, especially to get through these challenging circumstances. So First point of contact is going to be a lactation consultant. So when I say lactation consultant, you want to find somebody who's an IBCLC. Oh yes, myofunctional therapist. Awesome. I definitely want to talk to you more about that. And so yeah, that's the body work factor we're going to go into. But the first point of contact is usually going to be a lactation consultant, and you want it to be an IBCLC. That stands for International Board Certified Lactation Consultant. For other nursing stuff, there's other certified lactation consultants, CLCs, amazing resources for just really supporting learning how to breastfeed, different positions, and overcoming more simple challenges. But if you're suspecting a tongue tie, this is a more severe issue. You want somebody who's really an expert at diagnosing these ties, because the best person to diagnose a tie for real is an IBCLC lactation consultant. And these consultants are going to do a full assessment on baby. They're going to really watch you nurse. They're going to weigh baby before and after a nurse to see how much they get. They're going to do a full oral assessment to see the ties. And from there, they're going to refer out. So they're a wealth of knowledge, so they're really there to support you. The lactation consultant we love and recommend locally is called Latchy Mama. Kelly is the owner, and she does home visits. And she has her assistant do the home visits, and she's virtual sometimes, but she's amazing, and she is going to know for sure if your baby has a tie, and she's going to know the severity and if it's going to need a revision. And then she's going to refer out to a revision expert or a pediatric dentist who specializes in what's called a revision. So a revision, if you're not familiar, is basically a minor surgical procedure where they go in and basically remove the tethered oral tissue. So there's lasers, and then there's more like scalpel surgical snipping of it. And so it's a rather simple, quick procedure. If you, as the parent, are going to be in the room with baby, I recommend potentially watching some videos of this just so that you're prepared. Of course, baby's not going to love it. It is a surgery, but it's quick, and the benefits, if it really needs a revision, are going to be worth it. So there's Dr. Babak Gahari in Portland is the kind of go-to, if you will, expert in these revisions. So we often refer out to him. Kelly refers out to him. Lactation consultants refer out to him. So it is a drive across the mountain pass to the valley with your newborn to have this procedure done, but he uses a laser, which is much more thorough and a deeper of a correction. So you don't necessarily typically have to get it done again. There are other local providers who do it here in Bend, but we recommend Gahari if you can make it out there as the first next expert to see. So they're going. Some will do tongue and lip tie revisions on the same visit. And then once you get the revision, they're looking for that mobility and release of tension throughout that whole system. So when you talk about that dural system and how their mouth was anchoring down everything on that midline, when they release that tension there, it's like night and day. Sometimes it's immediately, like moms will nurse and they'll really feel this huge shift right away. And sometimes it's more of a relearning process that takes a little bit of time, but the benefits long-term from getting this revision can be huge. Yes, Madison, Kelly is so great. Oh, awesome. Well, good luck. Best of luck on the drive over to see Dr. Gahari. We can't wait to hear how it goes and to see you soon. I'm so glad to hear that you saw Kelly and things are moving in that direction. And again, this is something we see every day in our practice. It's a very, very common thing. And when the revisions are done, when they're necessary, it's huge. One thing to know if you're going into a revision is, if you're not aware already, are there post-revision exercises. So you will be required to do exercises in your baby's mouth, basically with your finger. Babies don't like it. Parents don't like it. You have to do it for about 4 to 6 weeks, typically, and it's miserable. People don't love it. I've never heard a good thing about the exercises. I'm just being completely honest. But they have to get done to make sure that the revision corrects and it doesn't come back and that tension doesn't come back. So just know there's steps to the process. It is a long-term game here, but when you get to the finish line, it is so rewarding, and it's just you've overcome so much already. Like I see my parents, new parents in practice who've overcome these ties and revisions and exercises, and you're like, bring it on. I am fully ordained into parenthood now. I can do anything. I can handle anything. And that really is how being a mother and father is. It's just, there's so many, challenges that come up, and, we grow and evolve, and we'll do anything for our babies. So this is just what we got to do. Okay. And then the next triangle of that village, if you will. So lactation consultant, revision expert, and then body work. So upside down frown care. I love that. I love your name. I would love to connect with you more. Mentioned myofunctional therapist, super important. Craniosacral therapy, super important. And then pediatric chiropractic care, which is what we do in our practice at Pure Light. And we refer out with all of the above. And basically all of those things are going to be working with that dural tension, that myofascial dural tension in the body to help unwind. And so this body work can be really good pre-revision to prevent a revision, because if the ties are minor enough, sometimes just releasing the tension in the jaw, getting the craniovault moving properly, we see a lot of success with that in our practice. Working with the cranium, the neck, the jaw, down through the spine, especially the top and bottom of the spine. So the sacrum down in the tailbone and the neck. When we can get that top and bottom unwound from all that tension and stress, often the tension from the ties, if they're minor, will be minimal, and a revision can be prevented. If a revision is still needed, body work post-revision is really, really important, because the body's going to be compensating. It's a huge release of tension, but then the body's going to adapt to that. So making sure everything is balanced and aligned and symmetrical, it's going to be really, really huge for that baby's healing journey. And with our practice, what's unique for us is we do a neurological infrared thermal scan on their spine. It's completely safe, non-invasive, and it allows us to really actually see where the tension is. And typically it is going to be the top and bottom of the spine. There'll be basically like a big red bar at the very top of the neck and a big red bar at the bottom of the neck. And we can really measure this and do the body work, clear the stress, pre or post revision, and then rescan, remeasure the temperature readings on the spine and see the huge release and change. And then of course, as a parent, you're seeing better latch, better weight gain in your baby, all those symptoms, colic, reflux, gassiness, constipation in baby will clear, and no more painful latch for mom, which will lead to so much more health and well-being and happiness for mom as well. As pediatric chiropractors, we are not diagnosing tongue and lip ties. We can certainly do an assessment and give you our opinion, but we do not formally diagnose the ties. We always refer to lactation consultants for that. And what else? I love seeing these babies overcome, and it's amazing to even just when that tension releases, instead of putting your finger into their mouth and checking inside, instead of the gagginess and the chompiness and the crying, they'll just be relaxed and calm and have a really healthy latch and suckle. And that just creates so much more calmness throughout the whole baby, which sets them up for so much more success with their development and growth and really optimizes their well-being. So we went over management of ties. I already kind of shared my recommendations on lactation consultant locally, Latchy Mama Lactation and Bend. Dr. Bob Gahari is the revision expert in Portland. If you're someone who loves to dive deep into learning more and more, there's a great book called Tongue Tied by Richard Baxter. That's a great resource to kind of dive deeper. So Madison, how soon after revision do you recommend getting chiro work? So we see babies within a couple days. It's never too early, and we won't necessarily do any intraoral work inside the mouth until like a couple days later, but we can do craniovault work, working on their head and neck and their spinal dural tension system. Sometimes the same day. People will go to Portland, come on back and stop in the office if it so aligns to get baby's first adjustment post-revision. So it's never too early. And then as the wound in the mouth is healing, we can do more deeper intraoral work, TMJ, jaw stuff as well. And I'm sure it's the same with the myofascial therapy as well. With that post-revision, there are recommendations for natural pain relief, because you don't want to see your infant in pain. I totally get it. There are homeopathic remedies. I'm not going to recommend them over the webinar. I don't have them handy, but there are natural homeopathic remedies you can talk to a naturopath about. And then there's less intense. Just my biggest takeaway is don't do Tylenol, because if your baby has a tongue tie, again, they likely have methylation pathway things going on, and Tylenol is just going to completely make that worse. So there are other options. So I mentioned the book Tongue Tied by Richard Baxter if you want to dive deeper. We are always here to answer questions at Pure Light. And if there are other specific questions, if you're doing a pacifier, there's specific pacifiers that are recommended. One's called the MAM, M-A-M. It's the only pacifier you really want to do post-revision. And then breast flow bottles. Literally, the brand name is breast flow bottles with paste feedings at a 4 to 5 degree angle. So when you, yes, it's such a good book. I agree. There's those two specific recommendations I just get asked about a lot. So MAM pacifiers and breast flow bottles, if you need to bottle feed at all, or your partner's bottle feeding, are really the only ones. So when you're talking about post-revision, they basically have to relearn how to latch and how to suckle. So you don't want to just do anything. And that's where working with a lactation consultant, revision expert, body work, where we can tailor our recommendations to you. But those are kind of general recommendations that are good to have. And wowzers, that was a lot of information. I covered it quicker than I thought I would. Just looking back at my notes, I think I covered it all. Thank you guys so much. Hi, Corlin. So craniosacral work. So yes, so this is a question we get asked a lot. So chiropractic adjustments, especially for babies, are very, very similar to craniosacral work. So we're always working with the craniovault, the upper cervical spine, and the sacrum, and then everything in between in the dural meningeal system. So that the contacts and the form of care is very, very similar to craniosacral work. Craniosacral work specifically is going to be done typically by a massage therapist. So it's just a different level of care, and there are some amazing craniosacral therapists. One of the biggest differences with craniosacral therapy is it might be a little bit longer of a session, whereas with adjustments, we're very, very specific in what we do, and the sessions just don't take very long. But so there are some great craniosacral therapists locally. Right now, it's from my recent experience, it's been hard to get in contact with a lot of them. If you find someone, definitely let me know, but a lot of them are pretty booked out. But yes, craniosacral therapy, chiropractic work go really well together, as well as the myofascial therapy. But yeah, we are always looking for more recommendations for craniosacral therapists in town. But if you can't find one, know that chiropractic adjustments are very similar and have the same objectives. That's a great question. All right. Any other thoughts or questions before we wrap up? All right. I so appreciate everybody so much for being live with me here. Again, this will be recorded, always on our Facebook and YouTube. It'll be up on our website in the next couple days. And we're so grateful that you're here. Oh, another question. Okay, so it sounds like upside down that you're not local. Sorry, the thing is blocking. Love that question. So looking to work with chiropractors locally in your area to collaborate as a provider. So you want to make sure that they are specifically trained in pediatric care. So the International Chiropractic Pediatric Association is the organization in the chiropractic field that certifies and trains chiropractors in pediatric care. Not every chiropractor who goes to chiropractic school is getting pediatric training, and not every person trained in pediatric care specializes in tongue tie. So you want to find an ICPA. So you go to icpaforkids.com and you can type in your zip code, find providers locally, and I would just call and ask questions. I would set up a meeting with the doctors and find out if they work with tongue ties, what lactation consultants are they connected with, and really see how often do they see babies. Like if you come into Pure Light in our office, you literally see babies everywhere. We take care of babies all the time. But if it's an office that doesn't really see that many babies, I would say it's probably not the best fit for ties. Yes, you are welcome. Oh, down in California. If you want to shoot me a private message and we can look up your zip code, and I'm happy to help you find someone. I know a lot of people who practice in California who did the same training and went to school with us. And if I can help you find a referral specifically for someone in your area, that would be awesome. So yeah, if you can shoot me a message on our Pure Light page, that would be awesome. You can also contact me, anybody, personally with my email, sarahlutz@purelightfamily.com. That's SARAHLUTZ at purelightfamily.com. And we're always here for you guys. So happy you joined. And sounds good. Looking forward to hearing from you. All right, you guys, I hope everybody has a great night. I am going to go make sure my 3-year-old is going to bed soon. She's with her dad. I hope everyone has a great night, and we look forward to working with you soon. Alrighty.